Hello everyone, my name is Joey Tapia Fusile, and I am back to talk about neurodevelopmental disorders. I previously did a video on neurocognitive disorders. I really wanted to return to focus on specific diagnoses that I have worked with and that I am passionate in helping those individuals within a rehab setting. I'm an alumni from the program, graduated in 2015. I have worked in vocational rehab, private rehab, and now I have some private practice, which I still do now, and I have returned to get my PhD in counseling here at UNT. So I wanted to break things down for you guys in terms of certain diagnoses within neurodevelopmental disorders. So for motor disorders, I'm going to touch on developmental coordination disorder and tic disorder. So I'm going to start with certain milestones that we should be that clients should be experiencing through development, specific motor milestones. So anytime we get background history, any intake forms, or questions that we may ask, we might want to understand their development a little bit more. So asking very specific questions if they experienced any difficulties with sitting, crawling, walking, any form of delayed in developing those skills, which possibly could be negotiating stairs, buttoning shirts, zippers, anything to do with fine and gross motor skills, which falls in line with those specific questions that we ask. So it's very important that we get that information from the clients, consumers, patients, depending on the setting, the terms might be different, to really understand what they actually what they've experienced in their life. So the developmental coordination disorder is usually only diagnosed when limitations in motor skills are significant and that they interfere with performance or participation in daily activities of living. So one of the specific things that we see with this specific diagnosis is it impacts family, social, school, and community life. So if we look at an individual who does have a developmental coordination disorder, their motor skills in terms of navigating their environment is going to be difficult. Navigating the school is going to be difficult. Certain buildings, if it's not accommodating to people with disabilities, they will experience some level of difficulty that will require some education or intervention or some assistance in some capacity. Certain things that you want to be aware of is their kind of daily routine. So getting dressed, what does that look like? Do they need help to get dressed? Do they need, how long does that take them? Is this going to take them an hour to get dressed from head to toe? Is this going to take 10 minutes? We kind of want to get an idea of that, because if we are going to work with them from a vocational standpoint, we want to keep those things in mind. As rehab counselors, we're going to want to help them, get everything that they need, but we also have to be mindful of the amount of time it takes them to get there, because that will take into account kind of how we set up, how we discuss goals and plans, and other maybe assistive devices that can assist them with those daily activities. Also, eating meals. One of the things that is often experienced is eating meals is difficult. Gripping utensils is very hard, and holding on to them. So even holding on to food and even moving it towards the mouth can be difficult. So being mindful of that as well. What we want to be aware of is that something that they're self-conscious about? Is that something that they don't like other people to see around them? Because that will impact how someone performs in a job site. In social settings, they might want to be more isolated because of these things. Noticeable limitations that they may be experiencing. Those are some things that we want to keep in mind. As well as handwriting is frequently affected with this type of diagnosis. So what that looks like is scribbles, not clear defined letters, so that can be difficult in schools. Academically, they can be impacted just due to the handwriting, and that is nothing to do with um, their inability. It's just the connections in the brain and how that those messages are sent back and forth, and that coordination that occurs is just not executed as well as the either teachers or employers might want. So that is also something to keep in mind. The wonderful thing about eating, dressing, and handwriting, there's a lot of assistive devices to assist with individuals with this type of diagnosis. It's just doing some research, finding what's out there, and seeing how we either can educate the client, consumer, patient on that information, or find external resources that can help either purchase that item or us purchase it themselves, depending on the agency you were in, to help them get there. From a multicultural perspective, one of the things that we want to be mindful when we're looking through that lens is the developmental coordination disorder. It is across all cultures, races, and socioeconomic status. It's just you will find that the way it's perceived is very different. So it's being mindful of other people's perceptions based on culture, based on race. Someone might have never ever seen this type of disorder before. So how do we deal with that, and how do we provide them that education and meet them where they are with that type of need? So there are conditions, and this is a difficult part about the DSM, is when we work with people with disabilities, oftentimes there's more than one thing going on for them. When that is the case, we do want to be mindful of, are there other medical conditions that are contributing to this type of coordination disorder? Things like cerebral palsy, progressive lesions in the cerebellum. So the cerebellum has a lot to do with coordination and balance, so we do want to be mindful of that. So that's why that history, understanding their medical history, is very important. We will find things that we don't know, which is okay. We can always consult with someone that we work with, a supervisor, or do some Googling, using your resources as best as you can. And then also neuromuscular disorders. These are the common ones that we'll find those types of developmental coordination disorder criteria within. So we want to be mindful of, is there something else contributing to this, or is it only this that we're dealing with? Specific to IDD, if that is present, motor competencies may be impacted as well. So we, again, want to be mindful of what other diagnoses or things have they been labeled with that have given us information that could potentially connect to what we are seeing in terms of coordination. Oftentimes, the literature shows that the co-occurring disorders with developmental coordination disorders include speech and language disorder, specific learning disorder, ADHD, and autism spectrum disorder. So that has us in a position to where we really need to understand what the client, consumer, or patient is bringing to us, and how that might impact their overall ability to function in everyday life. So yeah, I think I touched on a few key points, a lot of things to think about in terms of employment. I will always recommend that we use the GEN Accommodation Network to get some ideas in terms of how we can best provide information to consumers, clients, or patients, and or help them through this process. A lot of times these individuals will be receiving some form of therapy at some point, either occupational or physical therapy, sometimes speech therapy as well. If those are still present in their adult life and they are not receiving therapy, sometimes that is also an option. Do they want to learn new strategies in dealing with certain limited activities of daily living that are affected, that maybe have gotten a little severe as they have aged? So how do we address that need by also addressing other things as well? So something else to be mindful of. Now I'm going to move on to tic disorders. These are Tourette's disorder, chronic tic disorder. tic disorder is motor or vocal tics. So it just depends. We could have a mixture of both, or they can be one or the other. So we do want to understand, the onset. The literature does show that the onset does start at an early age in their development, around, I believe it was 4 to 6. So we do want to ask those types of questions in terms of history. What I found as well is in terms of their ability to sustain employment, even if it within mild or severe tics, they were able to sustain employment and get their job done. One of the things that they did note is just kind of how others are viewing that individual, that kind of self-esteem, that anxiety that is involved within the individual that cannot control these tics, as they are sudden, rapid, they reoccur. There is simple and complex. Simple can last milliseconds, very fast, like a blink of an eye, and complex can be a little bit longer in duration. We find that those worsen with anxiety, when a person is excited, when they're exhausted, and find that those types of symptoms are not as present if they are calm and focused during activities. Stress is a big one. That is where you will see it elevate a little bit, intensify. So understanding those types of differences can really impact our ability to meet them where they are in terms of what services do they need, or what can I do as a clinician to work with them and meet their needs in terms of within counseling. How do I get them to a place where they can accept their disability and find ways to maneuver their environment with these tics, whether vocal or motor. One of the things is that we will see is males are more commonly affected than females with tic disorders. Functional limitations, like I said, they're minimal. Even with mild or severe tics, one of the things, again, is just that social isolation, interpersonal conflicts, inability to work or go to school can, for those with severe tics that maybe are vocal, and are cursing words. So those they do not have control over. So they might be cursing all day. That might not be conducive to a work environment. So we do want to be mindful of that. What type of tics are they experiencing? What does that symptom look like in the moment, and how might that impact? How might that translate to their environment, to their work, to their school? I would say those working with adolescents transitioning to college from high school, we want to look at what services or what type of accommodations might be able to assist them in being successful and not feeling like they have to isolate themselves due to something that they have no control over. So that control piece, I think, is going to be an important concept in counseling, and how we address that, because that is something that they do not have control over. So how do we help someone gain control over what they don't have control over, or at least reframe it in a way that they can accept where they are and how they have to navigate the world and be able to move on, is going to be important. Co-occurring conditions that can be present is ADHD and OCD, which have a greater impact on functioning as well. So again, those questions about their past, it's going to be very important, because we do want to understand what is really impacting their ability to live and have the least restricted amount of functions, and be able to live in an environment that they can thrive in. So when there's compounding things like OCD or ADHD, we do want to take those things into account and understand how those types of symptoms impact their day-to-day lives, because that will also give us a direction to move in. with these clients, consumers, or patients. So yeah, I think that is all I had for tic disorders. Those questions are going to be very important in terms of the frequency of them, what do they look like, um, how frequent are they, and when do they get intense and when do they calm down. Those types of those differences within them, we can pull very important information to kind of build on what's our plan then. If we can put them in an environment where they can succeed based on what we know, how can we get them there? So that's going to be very important. I'm going to move on to communication disorders. I wanted to touch on this a little bit. I was very, very attracted to this specific section with my work on people with traumatic brain injuries and strokes, that communication disorders often were tied to that. So this is going to break it down just based on development, not necessarily a TBI or a stroke. So I'm going to touch on language disorders and social pragmatic communication disorder. Those are the two that I have worked with and that I feel is important for us to take a few more steps to understand exactly what's going on for the client, consumer, patient. So language disorders, problems and use of language, reduced vocabulary. One of the core diagnostic features of this diagnosis are the difficulties of use due to deficits in or limitations in comprehension or production of vocabulary, sentence structure. Things like word finding problems you will find present. So these individuals might need a little additional time to find the words that they want to use when they speak. And mainly that's due to the connections from the language part of our brain and it being produced by the mouth. So everything that goes into us communicating so quickly, it's going to require them a little bit more time to kind of put some words together to be able to get their message across. Poor understanding of synonyms, retaining new words. So learning is also a factor in this, and us being able to understand how that might be impacting their ability to be successful. So if I'm thinking of someone that's going through training through either work or even in school and trying to learn certain concepts, certain words that might not be able to be retained as quickly as their peers. So academic achievement is impacted, occupational performance, and effective communication and socialization. So we can just see those are four major aspects of our day-to-day lives. With someone with a language disorder, these areas are going to be affected. So how do we step in as clinicians and help them through that process? A lot of it is really having a space for them to where they can feel understood, accepted, and not judged for where they are. I think is a very important process. That relationship that is built within the counselor and the client, consumer, patient is very important through this process. One of the things I did want to touch on all of them, I just don't want to forget, is the messages that these people with disabilities receive with these specific diagnoses. We have to keep in mind what that looks like for us, what we are bringing into the room, and understanding these types of diagnoses. One of the things I see is with these specific diagnoses is the messages they receive from doctors, from teachers, from family, from peers. It's something's wrong with you, and either you're taking medication, you're going to therapy, you're doing something to fix it. Now, for most of these diagnoses, they won't be fixed. They will be remedied in some way with either medication, intervention of some kind, but they will not be fixed. So how do these individuals get to a place where they can have a trusting relationship in someone like us to help them through this process? Because it will be a process for them. So I think our jobs are going to be very important in that. Differentials in diagnosis, so things that can be contributing to this type of language disorder is going to be IDD, as they experience a language delay often. So it's important to know that, again, that background information. What do we know about the client, consumer, patient? And what do we know is contributing to X, Y, and Z? So yes, that's all I had for language disorder. Just key tenets to keep in mind in terms of what that looks like with the client and how do we step in and provide support and resources. Excuse me. Okay, so social communication disorder. Social can be interchanged with pragmatic. So it's difficulties in social use of verbal and nonverbal communication. So pretty much problems following the rules for conversation and taking turns. And one of the things that comes to mind immediately is the differentials in diagnosis is understanding, is it autism spectrum disorder? Because with that, we will see those types of communication difficulties. So again, that background information is going to be very important in our ability to meet them where they are. So communication within greeting, sharing information, manners, within social context might not always be appropriate. And this is just due to the type of learning and ability to grasp those types of cues throughout life that is not necessarily there or as great as their peers. So one of the things that we see within functional limitations is effective communication, social participation, development of social relationships, academic achievement, and occupational performance. So we can see these significant milestones that people would hit as they developed, but these specific individuals would miss a lot of that. So we can look at how that might impact their day-to-day life. We can break that down into they're going to most likely be isolated or rejected by people around them. And that's not purposely, it's by the individual with the social communication disorder. It is individuals in the community just don't understand exactly what that looks like. They're going to label them as rude, not nice, difficult to work with, difficult to talk to. So how do we educate the community, and how do we meet the client's needs with this specific diagnosis? And how do we challenge our own biases with someone that comes into our office with that diagnosis and with those experiences that they have? Because we will have the same type of experience that people that in the community, people in their family, friends have. So how do we challenge ourselves to kind of come down and meet them where they are, to accept them, to not judge them, and be able to provide an environment that is fostering a strong relationship that can help them kind of meet their needs, and so we can help them further along. Okay, so I touched on those two. I wanted to move on to attention deficit hyperactivity disorder because I don't have much more time. So I did want to touch on this topic. This is, I find, to be a very hot topic in our community within children, adolescents, adults. This seems to be everywhere. Any journal you will see, you will most likely find something related to ADHD. Those fidget spinners, I think we're all preview to those, and how those kind of just went everywhere in terms of things to help children with ADHD. So that is a hot topic for schools and parents, especially those working with transition students from high school to college. This is going to be very important to understand as many children and adolescents and adults are being diagnosed with this. And we also want to take some time to look at what does ADHD actually look like, and what research shows contributing factors to ADHD. So as rehab counselors, we need to understand how this impacts people, how this impacts us, because some of us might be diagnosed with ADHD. So what things might be contributing that we are doing every day and might not be noticing? maybe eating, maybe sleeping, maybe lack of exercise, who knows? There are many things. So being up to date with research in terms of specific diagnoses and populations that you work with can help you understand kind of where we are today. So ADHD can be contributed by other diagnoses and other disabilities. So visual and hearing loss can be seen with ADHD. There are sleep disorders, epilepsy. There's often a correlation between if they are diagnosed with that, there could be ADHD as well. So we want to understand ADHD as inattention, hyperactivity, impulsivity, poor planning. And for us, we do want to understand which one we are looking at. Are we looking at, is it a combined presentation of inattention and hyperactivity, impulsivity? Or is it predominantly inattention presentation or predominantly hyperactive, impulsive presentation? And the level of severity, whether it's mild, moderate, or severe. And the reasons for understanding the specifics is to be able to identify appropriate interventions for the client, consumers, or patients, and their families. A lot of what we do involves there's an educational piece there. So we do need to understand those specific ones and how those tie into their day-to-day and what accommodations that can be received to help them be successful through this process. I think that's one of our greatest strengths, is knowing how to meet them where they are and how to give them tools and strategies that they may not have been privy to before. Because again, what messages are these individuals receiving? Something is wrong with you. You are not able to pay attention. You are not able to be calm. You're impulsive. You're hyperactive. So those messages can be internally taken as negative. And I'm not worthy. I'm not good enough. So we have to be mindful of those things. Because yes, the label of a disability is going to give us the step into helping them, but we also have to understand the individual in front of us. What have they gone through? What are they experiencing? And what is going on below that diagnosis, below those other things that are going on in their day-to-day, and what is the core of their experience and how they view themselves in this. Similarities between diagnoses as well: autism spectrum disorder, social dysfunction, difficult to manage behavior, those types of similarities between what we see with ADHD and autism spectrum disorder are going to be things that we need to be privy to, things that we need to be mindful of, and know. Again, that background information I'm going to go back to because it's very important each and every time. So through a multicultural lens, one of the important things here is just to know kind of what the population stands at in the U.S. in terms of Caucasian population are more likely to be identified than Latinx and African American populations. So what that looks like for us culturally. So I know for cultural specific for me, ADHD might not be seen something as important because it could be just them. Families might not view that as something's wrong with my child. Rather than another culture might view that as something significantly going on for my child, and they need to be given something to help. So it's important to understand those cultural differences and what lens we are using to view this type of diagnosis. From a functional limitation perspective, in adults, poor occupational performance, attainment, attendance, and higher probability of unemployment, as well as elevated interpersonal conflict. So again, those messages that are being received, how are they receiving all of this when they know they're not able to concentrate as well, they're not able to attend work as much due to other types of things that might be contributing to this. One of those things, again, if we want to ask all those questions to really understand where they're coming from and how their diagnosis has really impacted their ability to function every day. that will be very important. And I am out of time. Oh my, we're at 30 minutes. So I want to thank you guys for listening. I hope to come back at some point in either another class or in another section. I really enjoy these conversations. I find it important for us to be aware of everything that is going on for an individual with a disability, and how our role is so important in coming in and taking all that information and seeing the individual for who they are and providing them with what they need. So I want to thank you all for watching, listening, and I hope you have a great semester. Thank you.